My TNCC cards exam questions. Subdural hematoma characteristics. Injury to bridging veins can take longer to manifest, especially in the elderly, making it very fatal. Pediatric fluid replacement guildelines for burns in children younger than 14 years or 40 kilograms. Give 3 milliliters per kilogram per percentage of TBSA, half during the first 8 hours, and the remaining half over the next 16 hours. What is the first action of the primary assessment, before the primary assessment occurs? Gather supplies, prepare room. Ian Pepsi. External hemorrhage. Proper tourniquet application. At least 2 inches above the site of injury. Normal range for CPP equals 60 to 160. What are the first 2 things you look at from a distance when approaching a suspected trauma patient? Alertness and any external bleeding. Main function of carbon dioxide when it comes to your brain. Primary regulator of blood flow to the brain. D equals disability, de brain, assess pupil response, and Glasgow Coma Scale. What is the intervention style in TNCC primary assessment? Look, listen and feel. Stop when you discover a problem and fix it, before moving on to the next problem. F equals family involvement, and full set vital signs. I equals 4. Goal is 2 total lines for access in a trauma patient. What is the mnemonic used for trauma assessment? AI. H equals history and complete physical. Pulsus paradocus. Decrease in BP greater than 10 mmHg, with inspiration. Pulse can also incur changes from inspiration. L equals labs. O equals oxygen and ventilation assessment, SpO2 and capnography. E equals expose the patient and look for any other signs of external bleeding. Environment control. Use interventions designed to warm the patient. What is FAST used for? It is one of the primary interventions for determining etiology of specific types of shock, mainly obstructive. What occurs during stage 2 progressive shock? Compensatory mechanisms begin to fail, decreasing systolic BP, rising serum lactate. What symptoms may occur during stage 3 irreversible shock? Bradycardia and possible dysrhythmias, slow, shallow respirations. What should be done in Italy for all shock patients? High oxygen initially, assume they are at a deficit for oxygen at their tissue level. Effects of hypercapnia on brain. Vasodilation. A equals alert, airway. What happens if you discover a large hemorrhage during you first look at a patient when performing AI model? Make C your priority, stop the bleeding and then proceed with the model. Go to C again, when you come upon it. What is repeated after initial interventions? Primary survey, vital signs, pain, focused assessment on all identified injuries with effectiveness of interventions. What is the mnemonic for steps taking place in C? Pepsi. Cerebral contusion characteristics. Capillaries damaged, maximum effects seen peak 18 to 36 hours post-injury. G equals. Gadgets. P equals. Pain assessment and management. What is a key assessment for detecting cardiac tamponade? Listen to the heart. If tamponade exists, you will hear dulled heart sounds, due to fluid being in the way. What three components make up the Glasgow Coma Scale? Eye-opening, best verbal response, best motor response. S and Pepsi. Skin moisture, temperature, color. CPP equals. Map ICP. C equals. Circulation. N equals. Nasogastric tube. Map equals. Two x diastolic plus systolic / 3. Cullen's sign equals. Bruising around the umbilicus. What are the primary factors that exist for shock in general? Inadequate tissue perfusion, mismatch between oxygen supply and oxygen demand. What is a hallmark symptom of a Lefort 3 fracture? Diplopia. P's and Pepsi. Pulses, pre-hospital 4. Burn fluid replacement guidelines in adults. Weight in kg 2 ml x percent TBSA equals total fluid to be infused in 24 hours. Give half during first 8 hours, and second half during remaining 16 hours. B equals. Breathing. Epidural hematoma characteristics. Rapid accumulation from arterial blood, often an acute finding. What is fast? Focused assessment with sonography for trauma. Care sign equals. Referred pain to the shoulder, caused by pressure to the diaphragm. How to measure proper OPA. Corner of the mouth to the tip of the ear. I equals. Inspect back. What happens as ICP rises to CPP? It decreases. Urine output for an adult, infant, neonate. Adult equals 0.5 ml/kg/hr, infant equals 1 ml/kg/hr, neonate equals 2 ml/kg/hr, mnemonic for G equals. MNUP. After chest tube insertion, what are drainage conditions you would notify the doctor over? If output is greater than 500 milliliters initially, and if you have greater than 200 milliliters per hour over 2 to 4 hours, how are some of the more insidious manifestations of shock? Narrowing pulse pressure and increased respiratory rate. Effects of hypocapnia on brain. Vasoconstriction. Turner sign equals. Flank bruising on either side. M equals. Monitor.